This patient came in while training for the San Antonio Marathon, dealing with a classic overuse injury affecting both lower legs and feet. At the start of the visit, I'm walking her through what's actually going on beneath the surface. Using a 3D anatomy app, I'm showing how the muscles in the lower leg, especially the soleus tibialis posterior and the deep flexors, work together to support the foot during running. When these structures are overloaded from repetitive mileage, they begin to tighten, fatigue, and lose their ability to properly absorb force. That increased stress then transfers down into the foot, often leading to pain and irritation along the plantar fascia. Understanding the why behind the pain is key, because if you don't address the root cause, symptoms tend to keep coming back. From there, we move into treatment. We start with focused, deep tissue work on the posterior compartment of the lower leg. This includes the soleus, which plays a major role in endurance activities like running, as well as the tibialis posterior and flexor digitorum longus, which helps stabilize the arch and control foot mechanics. The goal here is to reduce muscle tension, improve blood flow, and restore normal movement within the tissue. These muscles can get extremely tight with repetitive loading, especially in runners increasing mileage or intensity. This type of treatment may not look very intense from the outside, but the deep sustained pressure, especially in these highly sensitive tissues, can feel quite painful for some patients. She's tolerating it very well. Once the lower leg is addressed, we transition into the bottom of the foot. Here we focus on the plantar fascia, a thick band of connective tissue that supports the arch and helps with force distribution during walking and running. When overloaded, it can become irritated and painful, especially during the first steps in the morning or after long runs. By working directly into the plantar fascia, we're helping to decrease tension, improve tissue quality, and reduce strain on the entire kinetic chain. Since her symptoms are present on both sides, we repeat the same treatment on the opposite leg to ensure balance and prevent compensation. This entire video is sped up about 13 times normal speed. In real time, these treatments are performed with slow, sustained, deep pressure, allowing me to assess the tissue more precisely and pick up on subtle restrictions or areas of dysfunction. After soft tissue work, we move into dry needling. Dry needling is used to target deeper muscular trigger points that aren't always accessible with manual therapy alone. By inserting a thin filament needle into these areas, we can help reset muscle tone, improve circulation, and reduce pain more effectively. In cases like this, where there's chronic overuse and tightness, dry needling can significantly accelerate recovery when combined with hands-on treatment. In our treatment flow, dry needling is typically performed either before or after soft tissue work, depending on the presentation. However, when cupping therapy is also involved, we generally perform cupping first, followed by dry needling. This is because the suction from cupping brings blood to the surface, and we want to avoid interfering with that process. For runners especially, addressing these issues early is critical, because small imbalances can quickly turn into bigger problems over time. The combination of these therapies is designed to not only relieve symptoms, but also restore proper function, so the patient can continue training without setbacks. If you're still watching, don't forget to subscribe to our channel. Like, share, comment, and click that notification bell for daily videos. Online scheduling is available. Please visit us online at www.samsclinicsatx.com to schedule your visit today. Thank you for watching.